Today's video is all about nasal tumours in dogs, just how common they are, what the signs and symptoms are, and what we can do about it and how we can go about treating a dog's nasal tumour. My final question today is from V. Manel, who asks, do you have any information on dogs with nasal tumours? How common is it? And what dog breeds are most prone to this condition? So, nasal tumours in dogs, they make up about 1%, so 1 in 100 of all cancers seen in dogs. Now, as for those dogs which are most at risk, it seems to be longer-nosed dogs that are also living in towns and cities, so those living in urban areas that are, again, at a higher risk. The most common tumour type in dogs is something called an adenocarcinoma, and that's followed then by something called a squamous cell carcinoma, and unfortunately both of these are really nasty tumours, as I'll come on to. Now, if we're talking about a cat instead, lymphoma is something that's actually the most common, and from a cat's point of view that's actually much better because they can respond much better to treatment than the adenocarcinoma and the squamous cell carcinoma tumours that we see in the noses of dogs. So symptoms of tumours or a tumour in the nose include things like nasal discharge, so a really pussy and snotty discharge coming from the nostrils. Often it's just one nostril to start with. It certainly can then become both nostrils. The nose can also start bleeding. We can get noisy breathing, sneezing. Once the tumour's grown to a certain size, we can get facial deformity. So the side of the nose starts to kind of bulge outwards a lot of the time as the tumour's putting pressure, eating through the bone, and then pushing kind of out towards the outside of the face. Understandably, then we can also get head pain if we've got a nasal tumour. A dog can start rubbing their face, and we can get nervous problems as well because there's lots of different nerves that run kind of along the side of the face that can be implicated and affected by a nasal tumour in a dog. Now, these problems are quite similar to fungal infections and also foreign bodies, certainly some of them anyway. The nasal discharge can be very common, the sneezing, sometimes the rubbing of the face as well. Now, we're not going to necessarily get the facial deformity and things with certainly with foreign bodies, not likely with fungal infections either, but in the early stages they can look very, very similar. So how can we then diagnose whether we've got a tumour in the nose of a dog or whether we're dealing with a fungal infection? So aspergillus is the most common one here, or we're dealing with a foreign body. So that could be something like a grass seed or an awn up the nose, or a piece of stick or a blade of grass or something like that. So we can diagnose with x-rays, although actually a CT scan is often the best way to go about looking to see what's going on in the nose. It gives much better detail and gives a 3D picture as well. And then what we can do is we can follow that by something called rhinoscopy, which is passing a small camera up the nose, which allows us to actually visualize what's going on. That's not available everywhere, but it's something that, if can be done, is brilliant. And then we can also take a biopsy as well. So we can either do that with the rhinoscope, so using the camera to see what we're taking a biopsy of, or we can actually do that blind as well. And often that's also gives us a diagnosis of what's going on. Now, unfortunately, we're often only diagnosing nasal tumours in dogs once they're quite advanced, once the tumour has already been there for quite a long period of time. And if the tumour's invading the bone that I've already kind of touched on, causing that facial deformity, or if the tumour's close to the eyes or the brain, then unfortunately curative surgery is generally not possible at all. Now, if we're getting it earlier, in some cases surgical removal actually of the whole nose, or the whole front part of the nose and the nasal cavity anyway, is possible, and that can be curative. But really, it's quite a radical surgery, and it's normally only really reserved for small tumours that are located towards the end of the nose, so towards the nostrils and away from the brain. Now, there are other treatments that we can use. So chemotherapy, if we're using that alone, really these tumours don't respond well to that. They only have about a 30% response rate, so that's actually only 30% are responding, and often that response is really short-lived. If we're giving radiation therapy as well, then the results can be a bit better. I wouldn't say much better, but they can be a bit better, with the average remission time of about 12 months. And that ranges from about 9 to 15 months of age. Now, if the tumour, though, is extending into the brain, causing problems there, then, really, even with chemo and radiation therapy, we're only going to expect to get 4 to 6 months of remission with that treatment. So, unfortunately, for a dog with a nasal tumour, then the prognosis really is not very not very good. It can involve, potentially radical surgery and some intensive chemotherapy and radiation therapy. But even going through all that, we're not going to get a really long period of life afterwards.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.